Hello, good morning, and welcome to RG Africa Limited. Welcome to our cattle farm. Welcome to our YouTube channel. Today, we'll be discussing a very important aspect of our practice in the farm, which is medication treatment and how we care for animal, giving proper medication to animal to ensure their health and good feeding. Today we'll be talking about the different medication we give to different animals at different time. Giving medication at this point is very laborious for us. It requires very high labor because of our current condition in the farm. We do not have some facilities that may ease the work of giving medication for now. So as you watch, you may see some very funny scenarios trying to catch the animal and give the injection. We're working towards providing the necessary structures to allow us give proper medication professionally. But as for now, we have to do what I call the catch and inject practice, where we just catch the animal and then we give proper medication while putting it under restriction. As you can see from the video, we have arranged all our necessary drugs. We have the Tylosin, we have multivitamin, we have different drugs here, energy drugs, because some of our animals are looking weak, and then we have appetizers, just like the multivitamins. We have strong antibiotics here. So the Tetranol is strong antibiotic. So these are the LA. This Tetranol, that's LA. We will be giving these drugs to different animals depending on their current medical requirement. It takes lots of process to administer drugs in our farm for now. As you can see from this video, it takes a lot of energy to catch, especially the big bulls. You can see the funny scenarios. It takes a serious time of work for you to be able to catch the animal and give this medication. So we'll try our best to do it as more professional as possible. So here, what we do basically is you have to catch the animal by the head, to restrict it from dragging too much. Then you give, though we are not putting the animal on the scale, because we have done this over and over. We do gauging, by looking at the animal. We're able to know the required dosage to give. Some of these animals can take different dosage of medication. Why we give medication basically is a routine thing. We don't just give medication to every animal, but there are some times where we discover that we need to give general medication to all the animals. Such general medications are like the multivitamins, the dewormers, anti-parasites. Those, like, there are some parasites that are required monthly, or some routine treatment, like parasite like the tick. These ticks are blood-sucking parasites. They are very rampant in this area where our farm is located. So we do well to give anti-parasites every month. It's called, the one we use is the ivermectin. We give the ivermectin to keep these animals away from those parasites like tick. They stick to the body of the cow, and then they suck and make the animal very uncomfortable. So we give these parasites to help the animal stay safe from. We give the ivermectin to help the animal stay safe from such parasites. Ivermectins are given at different dosage, depending on the percentage concentration of the product and also the weight of the animal. There are some of these that are just 1% concentration, some are 2% concentration. Then we have also 4% concentration of ivermectin. So when giving, we do well to give according to specification of our veterinary doctor. We have veterinary doctor, but sometimes he's not very available, and also sometimes to cover the cost of all of the logistics and all. We having worked with him severally, there are some of these things that we can now do by ourselves. When we give this, there are different ways, different parts of the body where we give this medication, like ivermectin I was talking about. We give it not intramuscular. We lift the skin and just give the medication, the injection under the skin of the animal. You do well not to take the injection into the flesh, as it can lead to collapsing of the animal and even death too, because it's a very strong injection. But injections like multivitamin, they can be given intramuscularly, so we do that as well. You can see some of our animals are really big, so catching them for medication, for injection, is a very serious labor. But thank God, so our boys are very strong to be able to catch the animal and hold it still while we give the injection. The injections that are given at the back of the animal mostly are the multivitamins and xylitol. But the ones we give at the chest region, the neck region, are sometimes ivermectin and LE. The ivermectin, like I say, we lift the skin and then you just give it under it. It's always very interesting experience to give medication to the animal. The struggle, it's really an experience to give. And the reasons, there are different benefits of giving medication to animals. Let me talk about the multivitamins. Some animals will become very weak, loss of appetite. You see them not feeding very well, and for that reason you need to give multivitamin to them so that they can feed well. Multivitamin will help to improve their feeding, improve their agility, and also improve their appetite. This is why we give it almost at every end of the month. And also the dewormer, we use albendazole. Sometimes we can use the albendazole solution or albendazole tablets, anyone that is available to us, we use. You can see the drama in trying to capture these animals for medication. It's not a simple act. The animals are strong, healthy, and some are very large, so it's not easy controlling these animals. But we try our best to give. Now, why do we give multivitamins? I say we give multivitamins because of the to improve the appetite of the animal, and we give medications like ivermectin to improve, to remove ticks, parasites, and all of these other things that make the animal uncomfortable. And then we also give medications like the LA as antibiotics, the strong and long-acting antibiotics. So we give such medications to fight against every possible disease in the body of the animal, such as wound, such as internal injuries. We also give it for There are some animals that have fever. You see them shaking in the morning with feverish shaking in the morning. So we do all of that to keep the animal healthy, and then to keep them feeding weight. It's very important that you give medications to your animal at a good routine to keep them healthy. We give medications like Tylosin to fight against what the Hausas call Hanta, this liver disease. It sometimes you see your animal depreciating in size, in weight, losing weight. The animal will just be losing weight over time. No matter how it's feeding, the weight will not be appreciating. So give medications like Tylosin, the early, and a combination of that with multivitamin to improve their weight as well. So this is how we go. This is how what it takes to give medication in our farm, as you have seen it. We hope that we'll do better, and please do not forget to subscribe to our channel and follow, and then like and share, comment, tell us what we do better, how we can do it better as we grow up together. Thank you very much. Thank you for staying with us. We hope you have learned something, and we hope to do better as we grow together. Thank you, and enjoy the rest of the evening. Enjoy the rest of the day, and do not forget to subscribe, to like, to comment, and to share this content, and also to tell us what you think we can do better based on your experiences, your practices around your region. And you can also join us in this practice, ask any questions that you may want to ask. Thank you.